So, coming to the treatment of prostate cancer, I think we covered the top left corner, which is essentially going over the testosterone blockers. But I would love to sort of talk about the other newer agents, what we call as novel hormonal agents, that target specifically at the cellular level in these prostate cancer cells. We have the AR inhibitors, and that we are going to discuss, and also the enzyme inhibitor, so to speak, that is abiraterone. So without further ado, we'll just talk about these. These are sort of the laundry list of treatments that we have in our arsenal that we can use at different times. So just for our patients, we have the novel hormonal agents, but there is still utility of chemotherapy. And as Dr. Tawagi mentioned, there are a group of drugs called the radiopharmaceuticals that is up and coming, and that has shown improvement in prostate cancer patients that we'll also try to discuss. So, just to start off, we have the male hormone receptor targeting drugs that we know: enzalutamide, darolutamide, and apalutamide. Some patients might know it from their brand names: Xtandi, Nubeqa, and Nubeqa and Erlada. I tend to forget the brand names quite often. So, these three drugs are typically that have been approved in the prostate cancer settings in the various, whether it's castration sensitive or castration resistant. I would love to hear, how you counsel your patients whenever they are coming to start off any of these oral agents, and what are the things that you keep in mind from a patient's perspective whenever you are deciding for all these three drugs, if we can go over them one by one. Dr. Tawagi.
Sure. So I think there are certain circumstances where someone has what is considered a high volume of stage 4 cancer. And so in those scenarios, we actually want to give some of these drugs along with chemotherapy for 6 rounds of chemo. And in those settings, the only option out of those would be darolutamide or Nubeqa. That would be considered. And so that might typically be an option. There's another one called abiraterone, which I think we'll cover on the next slide, which is also very commonly used. Otherwise, if there is not a plan for giving chemotherapy, the options are enzalutamide or Xtandi or abiraterone, the one that we're going to talk about on the next slide. And so in terms of deciding which one, outside of the need for chemo, where I mentioned there's only 2 approvals, we think about potential side effects and other medical problems that patients might have. So some of them have a little bit more brain fogginess, and so you might, for a more elderly patient, want to avoid some of those drugs. Some of them cause rash. Some of them have a little bit more issues in terms of patients with a history of heart disease. And so there's a lot of factors that go into the doctor deciding which of these drugs they're going to give. And sometimes we can get special approval for some of the drugs that maybe, like apalutamide, which I didn't mention in this setting, can be given sometimes too in this setting. And so a lot of factors go in, and we'll cancel patients on side effects, that might also include things like hot flashes, worsening of erectile dysfunction, weight gain, leg swelling, depending on the medicine used, the brain fogginess that I mentioned, the rash, potential for a little bit higher risk of heart issues.
Yeah. Yeah. And I think, as Dr. Tawagi mentioned, especially for enzalutamide, we definitely keep in mind for any patients who have history of any seizures or falls, we always keep in mind that we try to stay away from enzalutamide in those cases, especially. Yeah. So, any other thoughts, Matt, before I move ahead?
Yeah, no, I'd echo everything that you guys had said, really. And, I think that, when we're showing patients different options, and all these medications sounding very similar. Why can't we pick one versus the other?
Yeah.
Are they interchangeable? Things like that. I think that you have to counsel our patients that each one is approved in a little bit different of a setting, actually. And exactly, like you guys said, I think there's certain patients that we may want to avoid things, that we brought up here. But yeah.
Yeah. And I think, again, as Dr. Tawagi correctly mentioned, we have something called as Zytiga or Abiraterone. And this drug, again, we modify the dose based on the diet. Typically, we ask the patients to take this on an empty stomach. If we are going for 4 tablets, that's 250 milligrams each tablet, with empty stomach. And, there is one trial that did show that if we take one pill with a low-fat diet, it has shown sort of similar efficacy with lower side effects. And that is something to keep in mind with this drug. And this drug is a little bit different compared to the ones that we discussed before, is that it is mainly stopping an enzyme from creating more testosterone. But Dr. Tawagi and Dr. Kurian, what are the things that you think are important for any patients who are on Zytiga?
Yeah, no, I think that the biggest things I definitely tell patients about are just the importance that if they're taking on an empty stomach, exactly how to take the pill on an empty stomach, and giving them typically we say at least 2 hours between taking food or another medication or things like that. So defining that time period, I think, is very important for patients to know exactly when they're taking other medications, maybe in the morning, and when they can eat. I think it's important to define that, just because there's some side effects that can happen if they end up taking the food or eating food, when they're supposed to take on an empty stomach, or vice versa, et cetera, that can cause, things that are outlined here on the slide. Low blood pressure, high potassium levels are some of the biggest issues that we see sometimes in patients that may not be correctly taking the medication. And then really making sure we're watching their kidney numbers, liver numbers, other things very frequently in the very beginning of part of things, just so they understand the monitoring part of things as well, I think is another important thing. And then definitely, if you're talking about someone that may have blood pressures or potassium level issues or things like that, and they may have heart issues or other things like that, I think it's also more to watch those patients a little bit more closely as a result of things as well.
Yeah, and I think it's almost it's necessary to take these medications with prednisone because of the said factors that Dr. Kurian just mentioned. To make sure that we are not having any adrenal problems, meaning you can have high blood pressure as well. So just to keep those in mind as well while taking these medications. Anything you want to chime in, Dr. Tawagi, or we can go ahead.
Yeah, I think just the one pill is with a low-fat breakfast. That's also really important to remember.
Yep.